Dr. Lisa Davidson has found her dream job thanks to an innovative new way of running her business called direct primary care. DPC is a direct financial relationship in which the patient pays their doctor in a recurring subscription model, giving both parties complete control over the terms of their agreement. This allows doctors to deliver a new kind of care that is personalized, proactive, and accessible via email, phone, and text message.
We work for them, we advocate for them, we spend more time with them, and we truly take care of them. And we save them lots of money.
Direct primary care cuts out the insurance billing, including all paperwork associated with filing claims and collecting reimbursements, giving practitioners more time and autonomy to do what they do best: treat patients.
I think if there's a common thread between all of us direct primary care doctors, it's that we really wanted to have a model that focused on patients and the relationship.
Under the traditional fee-for-service model, treatment options are tightly regulated by the institutions that control the payments. With DPC, that goes away, empowering doctors and patients to collaborate on the best options for each situation.
I love the model. I thought if people purchased care from me on a subscription-based model, then I can do all the services I want to without having to check with the insurance company, without having to beg an employer to pay for the service.
The result? Patients get immediate attention and direct care.
Patients know they can get into the clinic if they need to be seen face-to-face, same day. And just having that assurance takes a lot of the stress out of the doctor-patient relationship.
With a vision to accelerate next-generation healthcare and make direct care the new standard, Hint Health is building software solutions to give doctors and administrators the power of a traditional health plan at a fraction of the overhead.
Hint stands for Health Intelligence.
Hint's software allows providers to run these direct care businesses in an efficient, scalable way.
The reason we started the company in the first place is the US healthcare system is fundamentally broken, and we wanted to basically build a company that is in support of concepts that in theory at scale fundamentally change the way healthcare is delivered.
Doctors in this country don't really work for patients. They work for insurance companies. And so doctors across the country have been leaving the system and building direct relationships with patients and providers to deliver great care and in a new payment model that's kind of like Netflix subscription based.
This gives doctors stable revenue on which to innovate their offering and incorporate technologies that improve their relationships and accessibility with their patients. The model also provides much-needed relief to their overworked administrators and support staff.
Our acronym that explains where we're at right now is PIST. It's Post-Insurance Stress Disorder.
On average, administrators spend 25 to 30% of their day dealing with insurance issues for which they are not paid.
In the current fee-for-service business that we provide now, the only time a doctor is paid is when you come into the office to be seen. And that's because that's the only time we make money.
Direct primary care adoption has grown by more than 1,000% over the past 4 years as doctors and administrators increasingly look for alternatives that let them practice on their terms.
Go down. So go down. That's good.
Dr. Davidson is now in her 6th year of direct primary care with a completely full practice and a waiting list. Other doctors from around the country look to her for advice on starting a DPC practice in their area. And she says she couldn't do it without Hint Health.
They have a community that we can go on as physicians and as the office staff and discuss ideas and discuss what works and what doesn't work. And I feel like they've been with us every step of the way. I love my job so much more. And I get to see patients and I get to care for them and I get to listen and give them respect and compassion. And that, of anything, is what medicine's about. I will never, ever, ever, ever go back to the insurance world.
The ability to run lean direct care businesses with Hint software gives doctors a strong position in today's healthcare system, allowing them to connect with and care for their patients on a personal level at a very competitive cost. It's not surprising that more providers than ever are discovering and transitioning to this new model. In Longmont, Colorado, Tamara Banks.